Hello, everyone. Welcome to the Flint Community Webinar, your community resource. We are so glad to have you. And I wanted to start this webinar with a little bit of a reminder of how we got here. Our original webinar started as a response to COVID to make sure that people had adequate, trusted information about potential outbreaks in community. And today we've been lucky enough to have Michaela Corsi to talk to us a little bit about the outbreak that we're seeing in our communities and across Michigan. And she's going to talk to us a little bit about this cyclospora outbreak that we should be thinking about.
Great. Thank you so much. I really appreciate the opportunity to be able to talk to folks in community about what's going on because this is such an important topic and definitely something we want you all to be aware of, what the situation is going on, how you can seek care, and what the role of your local health department is when we have large outbreaks such as this. So cyclosporiasis, if you guys have not heard of it yet, this is a parasitic infection that is transmitted by eating contaminated foods. So foods that are contaminated with basically fecal matter that has these parasites in it can then transmit this illness. And so when individuals have those foods, you can see that typically it's about a week later is on average, but it can be anywhere between 2 days to about 2 weeks after you have that contaminated food that you can have symptoms that include things like watery diarrhea, explosive diarrhea, just GI discomfort. And really one of the big concerns with this is that it can increase your risk of dehydration. And it's something that often we see that it doesn't want to resolve on its own, and you can have this persistent diarrhea that goes on for several weeks to a month. And so it's really important that people know that this is out there, especially because that risk of dehydration, because it's such a prolonged course, and two, that this is a little bit different than a lot of other GI illnesses where we, usually do supportive care, where there is actually treatment. There are antibiotics that you can get for this. So it's really, we want to highlight that message that it's important to go to your primary care doctor or an urgent care if you are having signs or symptoms. So with this, across the state of Michigan, there's over 1,500 cases. This is something that's really rapidly evolved. There was, as of a couple days ago, a couple hundred cases, then we quickly exceeded over 1,000 cases. And the reason we're seeing more and more cases is, of course, we know that there's lots of people that are unfortunately being infected with this cyclosporiasis, but also we're seeing that more and more providers are being aware and they're testing. So it's a good thing. That's a good public health win, and we're excited to see that. That's part of the role of us at the local health department, is trying to do outreach, encourage people to understand that this outbreak is going on, making sure providers know how they can get testing done and performed for patients, and making sure that they're up to date in clinical treatment guidance. Really, I think that's some of the big things I wanted to highlight. The other big thing that I wanted you all to understand is that, at this point, we don't have a specific source. So we know that it's typically spread, or we've seen outbreaks in the past, it's typically through some sort of contaminated produce. So in the past, we've seen this connected to like bagged salad mixes or herbs like cilantro, basil, berries like raspberries, strawberries. And so all that being said, we are not quite sure what it is. We at the local health department, when we have individuals that do test positive for cyclosporiasis, we get those lab results, and then we end up reaching out to folks, and we ask a whole bunch of questions about all the places you ate, all the different types of foods you ate. And so we're kind of looking through all of that information at the local level, and then we send that on to the state as well. And since this is a large, what we call an interjurisdictional outbreak, it's happening across the state of Michigan. There are epidemiologists who are kind of our specialty disease investigators at the state level that are looking at all those factors to try to figure out what is the source, so that way that can be controlled on that level. So that's obviously the ideal situation, the goal. We want to figure out where this is coming from and be able to stop it at the source. But in the meantime, we do want people to know the ways that they can try to prevent this. So there's been a lot of guidance coming out about like the best ways that you can take care to prepare produce products, so that way you are reducing your risk. So it's really important to be washing those products. If you can, like scrubbing, like physical scrubbing of products, things like zucchinis, if you're going to eat those, is really helpful in helping to reduce it. Things like lettuce, if you're going to have lettuce, removing those first few outer layers and making sure you're really thoroughly washing it. big reminder that we like to say for folks too is like, even if you get something and it says, oh, it's washed, it's triple washed,
Triple
like you
washed.
still need to be washing it. So especially just given this situation. Unfortunately, washing isn't going to be, it's something that is helpful. We know it can help and be preventive, but we're not 100% sure when we wash things, did we get every single one of these little parasites? So the best thing you can do is cook it. So if it's something that you can cook, that is something we would recommend. The recommendation is to cook it to 158 degrees Fahrenheit. Um, and we can send out some extra information too after this if people would
Yeah.
like that, the guidance. I'm happy to help share some of that stuff that's been coming out from the state. So those are my top things. Yes.
Dr. Corsi, so much of what you said is important, right? And this idea of certainly if you're going to get green leafy vegetables, taking off the first few layers feels important. You described
Yes.
that mechanical washing as being something important. So not the thing where you just kind of soak and rinse, but that you should be pretty aggressive and sort of rinse
Yes.
of aggressively sort of washing your vegetables. And then you said something else important that there's no way to know for sure after we do that. And so, sort of the gold standard, the best way to know that you're protected is if you are cooking your vegetables to about 158 degrees. And so, making sure that you're doing that, particularly if you're someone at risk who, you know, a GI illness could really set off other illnesses or could be at real risk for you for dehydration, that those are things you can do to protect yourself.
Yeah, absolutely. That's a perfect way of summarizing it. Thank you.
How would, if someone is starting to present with symptoms, maybe they've got a little bit of GI upset, they're just not feeling very well. Is this something that they should wait out at home or should they be alerting their doctor immediately? How does that go for people?
Yeah, I think that at this point, we would definitely be recommending that you reach out to your doctor sooner rather than later. As we know, with this, it's something that if you're not getting that antibiotic treatment, it's likely going to go on for quite a bit of time. And now with the summer months, it's so hot out. It's already hard to stay up to date or up on your fluids. And now you have like an illness that's kind of setting you back too. Just definitely a good idea to reach out to your doctor early on and talk about if you think you might have this parasite specifically.
If I could share, part of the reason it felt important to talk about this today is early in the week we were starting to hear more about it. We were hearing it from, community members, and I think we heard from one of our own community members, someone who's on the panel today. Shannon kind of mentioned having her own difficulty with maybe having this illness, and I happened to be off from my residence on Monday, but came in today this morning, and it was all of what they had seen over the weekend were having. And so always my sort of internal metric as someone who sees patients, but I'm not, as busy as my residents are. And so when they come to me and they're like, EJ, we've seen so much of this, it feels like it's an important thing to get out and toward the community. So I really appreciate you giving us some tips and tricks to think about. The other thing I think is really important from your perspective is we are talking about how this presents, what we can do. Want to make sure everyone's getting out to their physician as soon as they notice symptoms, because you mentioned a few things. It's hot out. So being dehydrated, we're probably all dehydrated at baseline. I know I'm not doing the best with keeping myself hydrated. But then if you have any sort of chronic disease or other illness, and you are dehydrated because it's hot, and then you get this dehydrating illness, you're at more risk for severe things. Is that an appropriate way of describing it, Dr.
Yeah,
Corsi?
absolutely. I definitely think that we have to be super mindful of dehydration. That's the biggest thing that we're worried about with this. And so especially thinking about like it in your specific context of what other underlying conditions you have that put you at risk is very important.
Fantastic. We had a question from the community that says, what can we wash it with? Is water enough? People have been adding baking soda or vinegar. Are those things we should be considering as well?
Yeah, so typically the soap and water is going to be like the number one thing that we're recommending. And I think that like really highlighting again that mechanical scrubbing is going to be like the biggest portion of it. I know there's been a lot of myths about like how you can get it, if you should use bleach or not. Like, no, we want to use things that are food safe. And that's what I would really be recommending.
Right. So the food safe ingredients being baking soda and vinegar, if they're using
Yes,
that and doing the
yes.
mechanical scrub, they would be good. That's super helpful. We have heard from Dr. Corsi, she's talked to us about how this illness can present, what we should be careful about. What I really, really appreciated also is we're getting a sense of what to do, but we're also getting a sense of how it's trending in our community. And I know we'll be bringing you probably back next month to make sure we're following these trends and understanding, but I want to say shout out to the health department. Thank you so much for the work you're doing and trying to understand what the trends are in our community and following these trends so that we can be aware and make sure the community gets that information.
Thanks for having us.
Yes, and we've got Leah Johnson from the health department who's going to talk to us a little bit more about our annual report, things that community would like to see in the annual report, and some data that she'd like to share. So I'm super, super excited. Thank you so much to the health department for all the wonderful information and data that you always bring us.
Yeah, absolutely. So we just finished our annual report a few months after we really worked on and finished our strategic plan. So a big ask from the community at large was we want all of the data that you have, and we want it in a way that is transparent and readable and understandable. So we looked at it and said, we really want to do fun data visualization that's easy for everyone to follow. And we were playing catch up for a long time. So after COVID, we had put everything on pause. We really wanted to make sure that we had time to sit down and do the review of trends and analysis of our data now because we had done all of the catch up. One of my colleagues did 3 reports in a year post COVID, and we reported out all of our data to pass accreditation. But our goal now is to really do data sharing that the community wants to see and that show longitudinal trends within our community. So thank you to all of our colleagues. So for those of you who don't know, the health department is quite large. So we're 131-ish employees, give or take a few. And we do incredible work. Everything from our CD nurses that are working on this disease tracking project we just spoke about to our Healthy Start team that deliver pack and plays to families. And a huge thank you to Amna who helped do the annual report catch up. But these people are really incredible and out in your community every day. So what's different? We have specific branding now. We want to make sure that everything you see looks the same, is the same, and is fun and colorful to see. We're tracking those longitudinal trends, and we're shifting away from tables with numbers to really data visualization and fun data presentation. And we wanted to highlight some specific program metrics and tell a story. We really want to tell a story with data about our community, about our programs, and the amazing work that the health department does, and then show trends that the community want to see in our community data. So on one side is our personal health. That is a previous annual report with the table. And then this is an example page from Hearing and Vision. It really makes it fun and wonderful to look at. We want to make sure that we're showing important trends, right? So 27% of our middle schoolers are now needing referrals for vision. That is an increase from previous years, and we want to make sure that we're highlighting trends that are important for us to build programs and interventions around. So really pulling out some of those big numbers and giving places for our community partners who do work in these areas to make an impact. So our big focus is that data sharing, that data presentation. So what would the strategic planning committee do? Like we want to show what the community wants to see. So we tried our best to listen and really implement the things we heard in the focus groups we did earlier in the year. And we really wanted to tell a story about our programs and the impact, and then focus really on the sharing of specific information that the community would want to see. So this is really relevant. The top chart is the most reported violations to our health department. So our food service team goes out and they inspect kitchens across the county. And these are the most reported violations. So that improper hand washing is first, hot and cold handling. So that's food temperature control, that vegetables to 158 degrees. But for our purposes, we're really looking at oftentimes meat and refrigerator temperatures. And that's really what the community wants to see. So we want to tell a story. And the one below it really shows the number of hours our team puts in the field every year, making sure that we're monitoring food safety in the community. So you can use data to tell really important stories about the community, the things happening in our community, and then what our programs are doing. And then we wanted to showcase our impact. So there's a lot of things we do that people aren't aware of. For example, Children's Special Healthcare Services, they do care coordination for pretty serious medical conditions, oftentimes chronic long-term medical conditions, rare diseases. And one of our nurses will spend 5 years making sure that they're getting the perfect care and support for one of their patients that they have on their care roster. And we wanted to make sure that that is shown, the amount of time and effort our folks put in, and then also the impact we have in the community, right? That's over 1,000 people that were helped and provided services by our nurses that are struggling to do care coordination for complex illnesses. That tells a story about the impact in our community and what's happening in the community. So we highlight important trends on our epidemiology page, and we have our communicable disease report and our annual report. So our big question and our ask, and I'll throw the link to this in the chat too, is what do you want to see? So we are out in the community every day, and we did 341 outreach activities, which is incredible. Our 131 staff are out in the field every day, and we really want to know what you want to see. So you can request a digital copy as well as put in there what you want to see on next year's annual report. What trends are important to you? Maybe this has brought up maybe the food safety stuff has brought up something that you want to see and you want that in the next annual report. That's something that we can do. So send in your request and I can send you also a digital copy once it is published on our website.
Thank you so much, Leah. I see Nurse T has a question, and I want to make sure we get to her. Go ahead, Nurse.
Yes, of course.
Hi. Great presentation. I just wanted to highlight one of the things that we're seeing at Hurley Medical Center. I received a call about 3 weeks ago from one of our administrators. What we're seeing is an increase of youth ages 6th, 7th, and 8th coming in with obesity as their primary diagnosis. And so that has been overpopulating some of our services and taking up a lot of appointments versus with our patients coming in with like type 1 asthma. And so it's a kind of like a call out to see what can we do to help our youth, especially at that age, at 6th, 7th, and 8th. And I'm hearing now a lot of parents are sharing that their children are being put on medications to help with their weight loss. And I know some of it is from, us coming out of COVID, some of our environmental issues, more children are playing on the games, but it really is time now for us to consider and do something for our youth at that age.
I love that. Thanks, Nurse T, for sharing. I don't know if we really have Dr. Asher. She's just listening in the background because she's not panelist.
I'm here.
Oh, I know. I was like, I'm sure Dr. Ash's wheels are turning as we think about, and I wonder, are you seeing the same thing, Dr. Ash, in your panel or in what you see? I certainly am seeing it when I see patients, an increase in the worries about obesity in that 6th, 7th, 8th grade, right, is particularly important because it's sort of where our children developmentally are sort of moving into a more autonomous place. They're sort of more in control of their own health and their eating decisions, et cetera. And so, Dr. Ash, I'm curious what you think.
Yeah, I was going to ask to be unmuted. But yeah, we in addition to what this makes me think of is we're also seeing a lot of this age group come in with constipation. And I think the two are very interrelated. I was going to ask you if you meant, is it sixth, seventh, eighth graders or six, seven, 8 year olds? I just wanted
They
to
said
clarify.
6th, 7th, and 8 year olds.
Oh,
Okay, that's what I thought you meant. Yeah. So, I mean, this is actually a really interesting time for kids, especially like think of like developmentally, six, seven, 8 year olds want to be more autonomous, right? They want to start kind of doing their own thing. They want to, learn how to tie their shoes. They're reading on their own. They're super excited about these things. And the way that I kind of talk to parents about this age is we should be including them in all of our food decisions as well. So this is a
yeah.
really good age as they're learning to read and write. Okay, well, let's think about what you want from the grocery store. Let's write it on a grocery list. Let's take you to the grocery store. I personally make my kids pick out one veggie or one fruit every time we go to the grocery store together, something new, something that they're going to try. It's a really good time to get them cooking with you. It seems like kind of crazy to let a six, seven, 8 year old let them
Yeah.
cook. But you can actually buy plastic knives that are very kid appropriate. You can teach them how to use those knives. You can teach them how to cut things like avocado, which are really easy to cut. Even apples, some of the plastic knives can still cut those things. You can, a 7, 8 year old can put toast in a toaster, for example. They can pick out the wheat bread instead of white bread and make some toast for themselves. They can put almond butter or peanut butter on their own toast. So kind of encouraging them to start taking autonomy over the food they eat, helping plan meals, helping think of like, okay, maybe we don't love broccoli. Do we think maybe cheese on the broccoli would be good? Do we think maybe just putting some oil, like, can you help mama come and make this? Really encouraging those things. Because at the
Yeah.
end of the day, just like how they're very proud of themselves for tying their own shoes or writing something
Oh,
down,
be
they get really proud of themselves for picking out their own food and helping make a dinner. And they're more likely to eat that dinner if they're helping out. So that's my number one recommendation for thinking about how to get kids involved in meal planning and healthy foods. And then number two, there's a lot of activities that you can do even at home with kids to get them moving. So the two parts that I think of for health in kids when I think of obesity, which we know later in life can be tied to things like high blood pressure, diabetes, et cetera. Having them like even just, do some stationary running in the home, jumping jacks, getting them just moving and getting their heart rates up, whether it's like right outside your house, outside your apartment, inside the apartment, whatever it might be, running up and down the stairs, just making things fun and making little games. They don't need to do it for long. 10 minutes a day is a good place to start. And then the last thing I'll say, because I could talk about this for an hour and I won't, the last thing I'll say is know the kid, and don't do too much at once. So if
Yeah.
your kiddo is someone who generally has been like, watches TV for a long time per day, doesn't like to necessarily be involved in coming in meal planning, maybe like once a week, you just get them out and bring them to the grocery store. And that's your only thing you do for 1 week. Maybe the next week you add picking out your own vegetables. The next week you add cooking, do it in a step-by-step process. So it's something that's sustainable for the family and for the kid.
I know Dr. Ash is out on a run and I can see her teaching us all the sort of exercise and good habits that we need to build for ourselves. Also, shout out to that MSU shirt you're rocking today. Thank you so much, Dr. Ash. I really appreciate you. Thank
Yeah,
you so
thank you.
much, Dia, for the annual report. Nurse T, you always come with trusted, important information. Super appreciate you. I want to let GHP talk about their 25th anniversary. What a wonderful org. So super proud of the work that GHP does. We're so thankful to have you as a resource in the community. Jim and Shannon, I'm going to let you take it away talking about the millage and some of the things that GHP has brought to the community.
Wonderful. Thank you so much. We really appreciate the opportunity to be here. My name is Shannon Cezak. I'm the communications coordinator at the health plan. While we're all celebrating America's 250th anniversary, we're celebrating 25 years here at the health plan. 25 years of being here in the community and serving community residents, and ready to hop right into that. So you could advance the slide. Do I do that? There we go. So Genesee Health Plan provides a very basic healthcare coverage. It's a preventive coverage to Genesee County residents. So we're talking about doctor's visits, labs, prescriptions, x-rays, dental, and some mental health counseling, cancer screenings, and cancer treatment. And all of that coverage that I just named off is funded through a special countywide healthcare services millage to be able to provide that to our community members who qualify for the coverage. This millage was first approved and passed in 2006. It was renewed in 2012, and it was passed and renewed again most recently in 2018. And that was with 65% voter support. So that's a high amount of support from voters on this millage. It's a popular millage. Our current millage that we have right now, so that was 2018 start. It expires November of this year. It will be on the November ballot on November 3rd for the election. So more information to come on that. But in past elections with our millage, we've not seen any organized opposition. The community has been very supportive of, what we provide here at the health plan. Not only the healthcare coverage that the millage funds, but the health navigation services that we provide for chronic disease management, diabetes, high cholesterol, high blood pressure. We also have community health workers in the community that help identify barriers to accessing care or other community resources, utility assistance. So we kind of try to do it all here at the health plan. And going back, elections are much different now. I remember back in 2018, and I'm getting mailers now for elections for different candidates, but it was heavily focused on mailers. Digital was kind of stepping into its own, and targeted Facebook posts and YouTube commercials and, streaming services, and all of that isn't as big as it is now. So a lot has changed with, different campaigns, and it's just a different climate. So to be able to be effective in getting information out and educating the public on who we are and what we do and what the millage is and why it's important and the impact from that, we have to, change and be unique and innovative in how we get that information across to community members. So this is actually the ballot language from the ballot, the millage renewal in 2018. So this is what appeared on the 2018 November ballot for our millage. I highlighted some areas here that are key. So for the purpose of providing through the Genesee County Health Department a healthcare services delivery system, such as the Genesee Health Plan for uninsured low-income residents of Genesee County. The language is going to look very similar to this in November, except they've changed the duration from 7 down to 5 years. But that's going to be the major change that voters will see. So instead of 7 years, the duration will be 5. So again, like I said, it was renewed last in 2018 with a high approval rate at 65%. It passed in all but 2 precincts, and I will show on the next slide an area of map of those of the areas of Genesee County with the support. Before that was renewed in 2012 with 64% approval. And then it was approved in 2006 with a 53 to 47% margin. And again, 2006, that was the very first year that the millage was placed for voters to vote on. So that millage campaign involved a lot of, laying the groundwork down and educating the community on what the health plan is and why the millage was needed in the first place. It set the foundation and cornerstone for what we have today, and being able to continue the work that we're doing, the impact that we're making, and many more lives in our community that are changed because they now have access to healthcare coverage that they wouldn't otherwise have. Next slide, please. So this is that map I was telling you about. We took all of the precinct reportings from the 2018 millage renewal for the healthcare services millage, and we plotted it on a map. So you can see areas in the city of Flint, and moving outside of the city of Flint is in that green area. So we're talking like 70 to 95% voter approval in these precincts. As you go out county, it's still like high support. So we're talking from 50 to 70% of the precincts being in support in all but the two areas that are in red, which include Argentine and Atlas. We do have really great relationships with those chambers of commerce. There's a Goodrich Atlas Chamber of Commerce, and we're heavily involved with that. And then over in Gaines and Argentine, City of Fenton, and Linden area as well. So millage, what do we do? The most important thing for me, and also to Jim, who will be speaking in a moment, is educating the community about the services that we provide, the impact that we're making. All of us organizations that participate in this panel that are here to help community members, you know, we need to be able to tell the community why we still need to be here and the relevance, and we do that with impact. And we've made a great impact since the last 25 years. The health plan has had over 100,000 people on the plan at one point or another. And if you really think about that, that's a lot of people that wouldn't have access to cancer screenings or treatment. So for millage activities, for me, the most important thing is educating the community on that impact. So we do that in a variety of ways. We have monthly committee meetings, you know, that are comprised of different community members. Some individuals that are panelists today are members of that committee. We bring our staff together and we talk to them and say, hey, what are you seeing? What do you think? Is there a better way for us to educate? Are there events that we should be at to pass out information? And I alluded to this earlier, we're a member of all the different chambers of commerce. Genesee County has like 8 to 9 different chambers of commerce. So we're kind of all over the place when those meetings are happening and different events to make sure that we're visible and accessible. We are kicking off our education campaign right now. And, you know, towards November, tail end of October, we're going to be pushing, you know, for advocacy and support from our community members. And we provide presentations to a variety of different groups. Some of them include elected officials, community leaders, different organizations, groups, Rotaries, optimist clubs, unions, what have you. So I talked about this earlier. These are the different, the millage pays for the coverage that GHP provides. So medical services, when you see your primary care physician, specialty services, pharmacy, prescriptions, labs, radiology, mental health, dental, claims management, chronic disease management, that's the health navigation services, healthy lifestyle behavior support, and indirect costs on that. And I don't know if I have one more slide after this, but I wanted to say this earlier. If anybody on this panel, or if you're attending and watching, if you want to do anything to help, you know, support the work of the health plan and what we're doing, or educate, you know, we're looking for testimonials. We're looking for testimonials from current GHP members. We're looking for testimonials from community partners. Trusted voices. Nurse T is an amazing community advocate, wonderful advocate for anybody that she comes across that has a need. She's one to name a few. We're looking for those stories to help tell our story, because the health plan would not be here if we were not helping the people in the community that we're serving presently. So those stories are crucial to GHP and telling our story. If the millage is not passed in November, and I don't even want to put that out into the universe, we will still be around. We're not going away. We may not have GHP coverage to offer without those millage funding dollars to pay for those services, but we will still be able to enroll individuals into other healthcare coverages that they may qualify for. So that would be healthcare.gov Marketplace, Medicaid, Healthy Michigan Plan, and Medicare. But we will still be here, and we're not, again, going to plan on the millage not passing.
Jim, go ahead. I saw you unmute.
No, because I think I'm speaking next.
Yes. Okay. Okay, why don't we, Shannon, thank you so much for all of that wonderful information. I have experienced firsthand, how valuable GHP services have been and have my own sort of personal stories being able to use GHP resources in the community. And so I would just, if anyone has a story about a GHP resource that they've used, I can, if I were to think about some of the things we've been able to do with you all in terms of drive-through vaccine events, right? All of the work you do on the webinar to alert people to things that are happening in community. I think last year's flu vaccine event, we had a little bit of a superstar, and Dr. McCullough came out and helped us kind of think about how to get the word out and how important that was. And so just a significant shout out to all of the work that you all do. Every time there's a new change in the community, you all are always right on it and sort of reaching out and thinking about how you can be a resource. And as always, shout outs to Nurse T, because I agree with you. There's no one better or more trusted to get the word out in community than Nurse T. So thank you so much, Shannon, for talking to us about the millage, the importance of us thinking about it and realizing the extent to which that helps make sure we have the resources from GHP that we need. I think we're going to pivot a little bit, and it's not so much as a pivot because it still underscores how important GHP is in providing that wraparound care when sometimes we don't have the resources we need. So Jim, go ahead and talk to us a little bit about that.
Well, thank you. And yeah, healthcare is confusing, and I wish it was easy. And all the coverages and all of that, we hear a lot of different stories, and so we used to talk about the easy button, like the Staples commercials, and so I wish we could just press the button and make it easy for everyone. But what I wanted to kind of piggyback on from what Shannon talked about, and thank you, Shannon, is the fact that we feel there's a storm brewing here in our community on healthcare coverage. I drove home last night in a thunderstorm and could barely see, and people were on the side of the road. And I feel in my heart that there's a storm coming here. And a lot of it is tied with Medicaid changes that are going to happen. That these were first passed a year ago, July 4th, by the federal government. And are they going to start to impact Michigan residents, Genesee County residents, national residents, mostly starting in 2027? So next slide, please. And so these are some, this is a slide deck that the state of Michigan put together about a month ago now. And this is kind of the latest and greatest information on some of these changes that are going to take place here in 2027. So next slide, please. And next one, please. So when you see the reference to HR 1, that's the name of the bill. You hear is Big Beautiful Bill. A lot of people don't agree with that title, so a lot of people call it HR 1. As I said, it was signed into law a year ago. And the state has been working, MDHHS has been working on it since then, and really started putting a lot more effort in April as they were starting to get more information from the federal government. And the feds just released their final guidance in June. And so the state, again, has been working on finalizing what they're going to do because they're the department that's in charge of Medicaid in our state. And so just a couple dates to kind of keep in mind as we go through this is that and on October 1, non-citizen eligibility begins, and we're going to talk more about that, but that's already going to start happening October 1 with those groups of non-citizens who did have some health care coverage and now they will not. January 1st is really the beginning of the rest of these Medicaid changes. And then in March is when you're going to start seeing more and more people dropping off Medicaid, and so we have some time to prepare, and the preparations are away, and we'll talk a little bit about those in a minute. But we have our work cut out for us. So this is a good slide to kind of talk about some of those changes. So one of the big changes is that work requirements. People who are on Medicaid are going to have to show that they are working or volunteering or in school or doing job training. And this is for this what we call the Healthy Michigan Plan, or the Medicaid expansion. In 2014, Medicaid was expanded. Now there's an income-based part of Medicaid. It used to be just pregnant women and disabled and children were on Medicaid, and it expanded. And so this legislation really focuses on that Medicaid expansion group. And so those work requirements are for 80 hours in a month. And if they're not compliant with that, if they can't show that they're working those hours or in training or those requirements, they could start losing their coverage. So that starts here at the beginning of the year. Another key is the 6 month re-enrollments. Right now on Medicaid, people they have to prove their residency, their eligibility, their income, all of that once a year. And now it's going to be twice a year. And so I saw someone talk about this the other day. It's like, why do I only have to pay income tax once a year, and now I have to prove my eligibility twice a year in this? And so, but that's gonna, and a lot of what we're talking about today isn't that people qualify for these things. It's the bureaucracy, it's the paperwork, it's the filing, it's the does the state have enough workers to handle all of these things coming in? These are the challenges that we're going to be facing here. Another key is this retroactive. It used to be where if a person signed up or re-enrolled, it would go back 90 days. This is especially critical in the hospitals where someone came in for a hospital stay, didn't have insurance, and they could go back and make sure that that hospital stay was covered. Now, if they're on this Medicaid expansion, it only goes 1 month prior to application, and other enrollees 2 months. So again, that's an effective date of January 1. And I know some of you on this call, I know you well, and you work with the non-citizens. And there are definitely cutoffs on pathways for coverage for lawfully present non-citizens. And so effective individuals will lose full coverage, and they are going to move to emergency services only. Which that means is that that's really just emergency or inpatient care. It's like catastrophic insurance, in other words. It's not going to be for preventive services or seeing a doctor or getting medications, any of those things. And so that population who's been that have had Medicaid in the past will not have it anymore. And so, again, I know our partner organizations like the Free Clinic and Hamilton and Genesee Systems and their free clinic, real are their clinic there is really looking to how they're going to handle Amat Children's Health Center, all these places, how they're going to handle all these folks coming in. I don't have time to go over all these qualifying activities, but the key, and this is what I want you to remember. It's 80 hours, but it's 80 hours at federal minimum wage. And federal minimum wage is 7 something an hour now. Michigan's a lot higher than federal. So really, a person has to be making $580 a month or more. So that really is the key measurement here. And so we just need to learn this language, learn this lingo so that when people are asking us about it, we need to have this information in front of us. Exemptions. There are plenty of exemptions, and a lot smarter people than me say that about 80% of our population of who are on Medicaid will meet these exemptions. We just need to, but there's going to be a sign-up process for people, and they're going to have to prove that exemption every 6 months, and that includes caretakers and parents and guardians, and those are all listed out there. And I think that would be almost a webinar topic for this fall is all these things, these exemptions that are out there. But really, the key just to remember is that they're going to be out there, and that's kind of good news. We just have to help people apply for those exemptions and maintain those exemptions so that they will keep their Medicaid coverage. Next slide, please. So again, these requirements are going to happen when they apply for Medicaid or when they are renewing their Medicaid coverage every 6 months. These are going to be checked, and if they aren't meeting them, then they're going to be disenrolled on that. So next slide, because I only have a couple more minutes here. So these 6 month renewals again are going to start, and that's different. And so people are just going to need to know. One of the keys in all of this, as you're working with people, is a lot of people in our community have Medicaid, but they don't know it's called Medicaid. They don't know it comes from the state. They know it as Molina Healthcare. They know it as Blue Cross. They know it as Meridian. And so when they get letters or texts or things like that, they throw it away. They're like, I don't have this Medicaid, I have this. And so, but these notices and all these things are very key to all of this. Next slide. And just if we could just skip through a couple of these slides because I'm running out of time, but it really is going to be this theme that we've been talking about, trusted messengers, community partners like ourselves, the health plans, the managed care organizations, and our local DHHS office. We all have to work together on this. And so I know there's going to be efforts starting in the early fall as a community on how we can help people with this. How can we organize ourselves on this? And so I think that's going to be so critical. And you can keep scrolling through these slides as I'm talking because it's just, again, we just need to let people know that, hey, they're going to be communicated with. And it's going to be so critical, but more to come on the communication effort. Some of this communication actually is going to start in the next couple of weeks to people, just letting them know that this is on the way, that these changes are taking place. I think people are going to freak out when they see some of these texts, like the one that's an example in this PowerPoint. So we just, as trusted messengers, just have to say, hey, more information to come. We're here to help. There are resources that are going to be here in the community, but this is the reality. This is it. So yeah, and again, this PowerPoint will be available for everybody to look at, and more, and certainly these links, these websites have all kinds of information from the state. And if I could just take one more minute or two more minutes on the next things, if you skip through this, um, what we're finding is that we have the Medicaid changes, then we have these changes, and what we're finding is that about 28,000, those are the estimates that could lose their Medicaid coverage and their Affordable Care Act coverage because those subsidies went away in December. I think I was on a webinar where we talked about that. So there could be a potential of 28,000 people in the next couple of years in our community losing their health care coverage. The hospitals, I saw Nurse T put in the chat, hospital waits. ER is where people go if they have no health insurance, they go to the ER. They don't go to their doctor because they can't afford that bill. They know that when they go to the ER, that chances are they if they're billed, they just can't pay it, and the hospital has uncompensated care. So this is the storm I'm talking about. And so I just, more to come on this. I don't want to ruin our Friday here because I think we have a challenge, all of us, of how and this is really an interesting slide. This is the need, and this came from our local DHHS leader, Sandy Mose. Just think there are 1.6 million enrollees in Michigan on Medicaid, 97,000 of them here in Genesee County, 37,000 on this expanded Medicaid. But th these other two are just blow my mind. 76,000 people that they assisted in March with food assistance. And so food assistance has these same requirements. And so when I talk about these work requirements in 2027, food assistance, this huge block of people are also going to have to be under these guidelines. And those workers at our local office, 715, almost three-quarters of $1 million worth of state emergency relief because people need dollars to help pay utility bills and funeral bills and all of that. It's just amazing. And so more to come, but we all need to work together on this.
You can tell Jim's an OG on the webinar because he keeps saying, I don't want to go over my time. I know I have
I
to get to the
know.
next people.
I
Jim
was a
is
couple
Jim.
minutes over. I
I,
apologize.
we appreciate the information. There were two really important points. One, Nurse T, who's going to come up next with Sarah Bailey to talk to us a little bit about some programming. But Nurse T mentioned in the chat, this is going to extend ER times. That is a problem for all of us. That is not just a problem for the people who are experiencing this loss of Medicaid. That is a problem for every last one of us who might have to use the ER. So as much as we might internalize this and think, and no one here would do this, right? But much of us don't internalize the problems that are happening to other people. We all use this public infrastructure, and it means that we might see delays in care because we're not providing care for others and we're not providing care for community. The next thing I will say is that GHP understands this better than most. They stepped into the safety net when people were without resources, and this is exactly the work they're going to be doing next. So we're going to hear from you a lot as we move forward and as we solve this problem together. I have so much love for Nurse T and Sarah Bailey. Thank you so much. Reverend Doctor, you have my heart. Thank you so much for all the work that you both do. Talk to us about the Health Impact 360, and please don't be mad at me for taking some of your time.
No problem at all. Good afternoon, everyone. Greetings from my seal at the University of Michigan Ann Arbor, Michigan Institute for Clinical and Health Research. My seal, or SEAL, the SEAL project, is the only one that is commissioned in the state of Michigan. So we have the responsibility for the entire state. And we have been operating since August of 2020, initially to help the underserved and under-resourced vulnerable communities understand COVID-19 and the various complex subsequent variants and the precautions that people needed to take as we learn what actually worked to combat this disease and keep our communities safe. Once we began to combat COVID, we pivoted to helping communities understand the social drivers of health, or better known as the social determinants of health. Specifically, the MySeal team and community leaders from throughout the state of Michigan decided that we would ambitiously tackle two identified health issues in our communities. One was menstruation-related anemia, and the other was cardiovascular disease. Thus, the March program, which I'll come back later in the year and talk a little bit more about, and Health Impact 360 interventions were developed. Health Impact 360 was first rolled out in Detroit and is now focusing on the Flint community. Before I turn this over to Dr. Jennifer Garner, who is a registered nurse and nutritionist from the University of Michigan School of Public Health, who is leading HI 360. I wanted to give honor to both Nurse T, Dr. Gordon, and Cherise Stapleton for all of the efforts they have in making this happen in Flint. Dr. Gordon, the stage is yours. Dr. Garner.
Well, thank you everyone for the opportunity to be here today. As you saw on the prior slide, this is a true team effort across the entire state of Michigan. We will provide these slides as PDFs because we want to make sure you can digest them as you go. I want to give quick credit and important credit to the leadership team who brought the Community Engagement Alliance to Michigan, including the late Dr. Barbara Israel, Dr. Valbuena and Dr. Marsh in partnership, of course, with Dr. Bailey, Dr. Reverend Bailey. And I was fortunate to join this team in 2024 as we started to do health equity interventions. So today, very briefly, I'm going to give you an overview on what is Health Impact 360. We'll leave you with the slides and we'll be here to answer any questions as well. So what is Health Impact 360? We were tasked by the National Institutes of Health to basically balance the scientific rigor that we would expect out of an NIH-funded clinical trial and health equity intervention with very authentic community engagement. So you saw on one of our prior slides I threw out very briefly is that we have the steering committee of 12 organizations that represent the breadth of the state of Michigan, and certainly there are many more who could continue to be involved. We decided to focus one of our interventions on healthy eating and active living. And specifically, we were motivated by the fact that Black, Hispanic, and other minoritized communities in our state and beyond are disproportionately impacted by cardiovascular disease. And that while we often think of things as a registered dietitian, my PhD is in nutritional sciences. Yes, I care about healthy eating, but it's not just about what you eat, right? There's a lot of other things that go into heart health and chronic cardiovascular disease risk. And so we wanted to do something that also respected the fact that mental health and social health and support are so foundational to our community health as well. And so that's what we envisioned was something that could address the full scope of cardiovascular risk factors and do so in a manner that is comprehensive with attention to social and mental health. And so that was the birth of Health Impact 360 in partnership with our statewide steering committee and our working group, which was a broader mix of individuals, organizational representatives. We developed a 16-week in-person community health worker-led heart health program to support social, mental, and physical health. And it's characterized by group walking, hands-on cooking lessons, and supportive discussion and resource sharing. And for those of you who like to nerd out about research, this is built on many years of intensive research and integrates best practices from three existing interventions: Black Impact, Walk Your Heart to Health, and Cooking Matters for Diabetes. Ultimately, this is the curriculum we came up with together. 16-week program where there's an initial 8 weeks that are an intensive period of behavior change focus and social support where groups meet twice a week. And then after that, they go into more maintenance mode, meeting once a week. The curriculum you can see is color-coded. It covers comprehensively all the heart healthy behaviors and indices we might think of: healthy eating, being active, managing our blood sugar, controlling our cholesterol, etc. But also there's complementary cooking sessions that put these lessons into action in a hands-on way, and we break bread together as a team. And that's also really powerful. Explicit coverage of mental and social health, maintenance planning, and also the fact that community matters. And so it's very comprehensive. This, of course, because we're NIH funded, is a clinical trial, and we're testing whether this can work. Is this feasible? Is this impactful? We wanted to do so in a way that appreciates equity. And so while we are doing a randomized trial, it's what we would call a 2-arm and 2-group trial. Our delayed intervention control group is such that every single person who enrolls in this program gets the program. Some get it first, some get it later. Everyone gets it. We also have very expansive real-world criteria, inclusion criteria. This is not limited to anyone based on sex, gender, age, racial, or ethnic identity. So less policing on the part of us and our partners on who gets to benefit, and greater generalizability of the results that are coming out of this work. And finally, we are allowing a really innovative enrollment strategy where you're allowed to enroll not only as an individual, but as a dyad or even a triad if you want to participate with a sister, your partner, your husband, etc., bestie, a couple of besties. We want to capitalize on that existing social support. So this is a clinical trial. Individuals who opt to enroll in this would be randomized into either wave 1 or wave 2 of the program. But again, we are excited to allow people to enroll with others who could be supportive in this health journey. As Dr. Reverend Bailey mentioned, we've already rolled this out and we're halfway through this trial. We did the first couple of waves in the Detroit community and had some really powerful findings and results among our community members. And now we're really excited to bring this to Flint. So thank you for the opportunity to share this. I only have a couple more slides. I want to share that one risk for any scientists on the call. I think the norm in our work is that we tend to really focus on high-risk clinical populations. So historically, some of the trials I've been a part of, we only focus on, say, individuals with really high hemoglobin A1C or really high cholesterol, right? Like individuals who are at imminent risk of a health event. The risk of us focusing on a broader population is that we might not be poised for impact. What if we enroll people who don't actually need support, right? Having such broad inclusion criteria can feel risky for scientists. What if we don't show impact? What we saw so far in Detroit, we have 166 individuals so half of our individuals have already been enrolled in and participated, and we have pre-post data for them. And what we saw so far is that we are still poised for impact. We know chronic disease risk is heavy in the community. 80% of our participants have multiple clinical risk factors based on blood pressure, BMI, cholesterol, and hemoglobin A1C. 80% have multiple high indicators. Our goal at the end of the day is that every participant will experience at least one measurable improvement in their health. So beyond this being a clinical trial and generating rigorous evidence for community-based, community-embedded cardiovascular care, we're having real-time impacts on our participants. And so far, we've seen this to be true in Detroit, and we hope it will be in Flint as well. So I'm going to end by saying thank you for this opportunity to share with you that this is happening. Please spread the word. If you click, when we share this out, if you click on this link, it'll take you to our website. If you Google Health Impact 360, it'll take you to our website. I'll click on it right now and see if you, so we'll share that out, and we would love to just get the word out and invite people to this who are interested. So thank you for the opportunity to be here, and I'm happy to take questions. Yep.
Thank you so much. This is such a wonderful resource to be able to bring to the community. Thank you again, and we'll make sure that we continue to share, and we'd love to bring you back. One of the problems with doing a good job on the webinar is that we ask you to come back. So thank you so much, Dr. Garner, for all of the wonderful expertise that you shared and the work that you're doing and bringing this to Flint. Two things for people to remember: be careful with your fruits and vegetables. Please wash them mechanically, do your best, or cook them. If you're not feeling well, get to your doctor. Remember that GHP is a wonderful resource in the community. Please, please, please look into that resource and consider it. And we'll see you next month. Thank you so much.